For a long time, women's health was stigmatized, deprioritized. It's crazy.
It's easier, but it's not right.
It's not right. Knowledge is power. It's not in your head. You actually have the evidence of what's going on.
Dr. Alice McGee, welcome to What the Flo.
Thanks, Angela. Great to be here.
Great to have you. Now, tell me, what motivated you to get into women's health?
So what motivated me to get into women's health was my own experience of getting my first period. Had really heavy periods, would soak through my pad at school, nearly fainted in the bathroom. And my experience was that I didn't really know much about it. And I was just really shocked by the lack of knowledge in the space and wanted to learn more. So motivated me to get into medicine and specifically women's health.
What's something that as a doctor you cannot believe is not yet common knowledge?
I still think how little the general population know about the menstrual cycle still shocks me. I don't think it's anyone's fault. I think it's just something that is not well enough talked about in school. And what we're seeing is women are increasingly going more and more to social media for that kind of information. We actually did a Flo study and we found that over half of women in the US who we surveyed didn't know how many days a month they were fertile.
How many days are they fertile?
So typically your fertile window is 6 days. You've got the 5 days in the run-up before ovulation.
Mm-hmm.
Ovulation happens, that's when your body releases an egg from one of your ovaries. And then you have that day after where you're also still quite high in terms of fertility chances. That's such an important thing to know in terms of, if you're trying to get pregnant or if you're trying to avoid getting pregnant. And it's one of those things, knowing that is so helpful for women, but so many women just don't know.
I had no idea until we were trying to get pregnant.
Yeah.
Like no idea. And I think so many young women are kind of frightened. They've spent years trying to avoid that, trying to dodge that.
Yeah.
And then suddenly you don't have any idea.
Yeah, absolutely. That information is so helpful because if you know what to look out for, if you know what to expect, what to track, so changes around ovulation, like discharge changes, you may actually feel more energetic, more sociable.
Yeah.
Sex can become more appealing at that time. So knowing all that information is really helpful to understand your cycle better. There is that kind of, discussion about syncing your cycle with your lifestyle, knowing and not beating yourself up for those times where you're not feeling your best and when you should take it easy. And then also considering scheduling, those important meetings, those important calls for when you do feel your best and when you feel most sociable and most confident.
Yeah. Let's dig a little bit deeper. Can you walk us through? Talk to me as if I'm a small child. What happens during a cycle?
So average cycle length is 21 to 35 days. You count your cycle length from your first day of your period until the day before your next period. And your menstrual cycle is divided into two main phases, which is something we see wrong on social media a lot of the time. There's actually two main phases, follicular phase and luteal phase. Your follicular phase starts with your period, your first day of your period, and your luteal phase starts with ovulation. So your period and ovulation are two events that happen, but they're not actually true phases as such.
When I ovulate, can feel my egg drop. Is this a myth or a delusion?
So there is actually something called ovulation pain that you can experience. So it is like you'll feel it on one side. It can be a sharp or a dull ache.
It's sharp as hell.
You're really in tune with your body, Angela.
Honestly, it's like a little superpower. I'm like, boom.
Yeah.
My egg just dropped. So it's go time.
It's go time, exactly.
If you're that way inclined.
Yeah.
Yeah. Okay.
Or avoid time, depending on what you want.
Or dodge.
Yes, exactly. Yeah.
Okay. Nothing makes us ask WTF, what the Flo, more than the women's health research gap. So we are going to make a little timeline and you're going to help me, I hope. I have a list here of different events for us to go through, okay? Yeah. What came first? The Women's FIFA World Cup or women being included in clinical trials?
The Women's FIFA World Cup. It happened in 1991 and women weren't included in trials as a mandatory thing until 1993.
So up until that point, all testing and all trials were done only on men?
Yeah, it wasn't mandatory to include women. So women often weren't included because they were seen as more complicated to include. Their cycles weren't taken into factor. So it was always focused on men, actually.
So was that because the hormones would potentially scupper the results or slightly skew the results?
It was seen like that, it was kind of like an extra complication to factor in the menstrual cycle and factor in other things like pregnancy and breastfeeding. So it kind of just seemed that it was easier to leave women out.
It's easier, but it's not right.
It's not right. And we're still finding in a recent study in 2022 by Harvard Medical School that women are still underrepresented in research. Although, yes, 1993 it became mandatory, it's still an ongoing issue that there is that underrepresentation of women.
What came first, Alice? Gilmore Girls reboot or a TV ad showing red period blood?
So actually, Angela, the Gilmore Girls reboot happened first in 2016.
Reboot?
Yep.
Stop
Reboot.
it.
And then in 2017, we saw period blood being demonstrated as red rather than blue for the first time.
Shocking. Remember, it used to be blue, little test tubes with blue water.
Nothing like blood.
Why do you think that was? Because it felt too explicit almost?
I think that's what it was. I think maybe people felt it was too like real blood and too shocking.
What came first, COVID-19 or a study to research the number of nerves in the human clitoris?
So COVID-19 came first. The pandemic was declared in 2020 in the UK, and that study wasn't done until 2022 when we found out there was 10,000 nerves in the human clitoris.
That's a lot of nerves.
Before that, we based it on the cow and we knew there was about 8,000. So we now know that the human clitoris has 20% more.
The biggest takeaway for me is that a cow has a clitoris.
I know.
Lucky girl. Talk to me about how gaps in research impact how women and girls kind of learn about their bodies and manage their health, more importantly.
Yeah, absolutely. So these gaps in research and gaps in education are so important because it means that girls and women are underinformed about their health. They don't know what's normal, what's not normal. They don't know when to seek help. And that actually has a really big impact in terms of diagnosis of conditions. So we see a lot of conditions like PCOS, endometriosis, that often have large delays in diagnosis because women just don't have the information.
Why do you think it has taken so long?
I think it's one of those things that for a long time, women's health was stigmatized, deprioritized. I think kind of the priority was on men and productivity. And I think only now that women are becoming more and more vocal, we're realising the importance and issues that come from women's health not being prioritised, that now we're seeing more of a focus on women's health research and the benefit for everyone that happens when we have well women in our society.
I think so many women struggle to feel heard, like properly heard in a doctor's office when they have concerns around their health. Do you have advice for women trying to advocate for themselves?
I think advocating for yourself is so important. And what I would say, one takeaway, knowledge is power. The more you know, the better. Learning about yourself is so, so important. So, for example, you can use Flo to help track your cycles, use Symptom Checker to understand the symptoms you have and what they could possibly mean. And then you can actually take all the information, all the tracking, symptoms, cycle information to your doctor and actually have that information and evidence there. It's not in your head. You actually have the evidence of what's going on. So I think that's really important, is informing yourself, arming yourself with all that evidence and information, and then it makes it a lot easier to speak about what's going on for you.
Because I do think sometimes doctors, I'm sure, are bombarded with people going in, they hit Google and they have great ideas about what's going on. But with an app like Flo, you actually have concrete data, really, and data points and symptoms that are not, you know, that show you a picture.
Absolutely. And like similarly, knowledge is power, but also data is power too. You can't argue with the data that you have. So noticing what's normal for you, learning what's normal for you, and then noticing changes does help make those conversations so much easier.
There's a lot of misinformation out there as a result of kind of gaps, I guess, in that research, especially on social media, which can feel like a great thing, exciting, accessible.
Yes.
But what should people keep in mind when they're scrolling?
Remember that you really need to check where this information is coming from and whether you can actually trust it. So look at the person who's providing it, look at the organisation or the company. Is it coming from a doctor? Is it coming from a registered healthcare professional? Do they have a license? Do they have the credentials? There's some useful tools online, like YouTube have a health shelf, for example, which does tell you that they're a verified educator, which is really helpful. So I would say take everything you see with a pinch of salt, do the investigation and see, is this actually accurate and reliable? And try to stick to sources like, for example, Flo or other areas where you know that the information is verified by doctors and checked before it goes live.
I do love that. It feels very soothing when I'm reading something and I see a fact checked.
So we find that 63% of women aged 18 to 24 learned more about women's health on social media than they did at school. So it's really important that we actually do have accredited people out there putting out true stuff, not fake news.
What is Flo doing to close the female health research and education gaps?
So this is so important to us on the research side and the health education side. We have a science and medical team in-house. We've got loads of doctors and we also have our expert board of doctors too. We're regularly running studies with our Flo users, with affiliated universities to really get more data and insights into women's health and understand patterns and trends and what's going on.
Fighting the good fight.
We're fighting the good fight, exactly. And it's so important.